It's the time of year a lot of us may be feeling under the weather, and what happens? You get a cold, you want to feel better. A lot of times you think you need some medication for it, but it's important to make sure that you are taking the right medicines for the illness that you have. And antibiotics are not always the answer. Here was some important advice on when you should and should not take antibiotics and the important issue of antibiotic resistance. We're pleased to welcome Lynn Kelso, an assistant professor with the UK College of Nursing.
Hi.
Thank you for being with us today.
You're welcome. I'm glad to be here.
This is a big topic among patients and their physicians. We'll start with the basics on when you should have antibiotics.
Well, I think it's really important to understand that antibiotics work for bacterial infections. So when you have a viral infection like a cold, a lot of times otherwise healthy people who get bronchitis, 90% of the time those are caused by viruses. Antibiotics are not going to help you in those instances. So going to your doctor and understanding what the problem is and if you actually have a bacterial infection, that'll help you figure out whether you need an antibiotic or not.
And so many times patients will have had a favorable experience. They felt like the antibiotics cleared them up, and they may go to the doctor and request that. What's your advice on kind of letting the doctor just figure out on their own what the problem is?
I think it's really important for the doctor to be able to figure that out. And one of the other problems that is out there is you can actually get antibiotics in different ways without a prescription. So people who have had that favorable experience before think, I've got the same problem, I'm just going to get something that I had before. And it may not be the same problem. It may not be the same type of infectious agent that causes that infection this time.
And with any medication, obviously you want to have the prescription from your doctor, but what's the danger if you start self-medicating and taking antibiotics thinking that that's what you need?
Well, it may not be the right thing. It may not be the thing that is going to treat what you have. Second, there's some statistics out there that say that, for someone with bronchitis, there's about a 1 in 4,000 chance that an antibiotic will help you with that. There's about a 1 in 1,000 chance that that antibiotic will send you to the emergency department with a rash, with some type of allergic reaction. Patients who have taken antibiotics might get a diarrheal type infection afterwards. So there's a lot of problems that can occur with them because they are a medication. So you have to be very careful with that.
And of course, from an overall health perspective, there's a lot of concern about what's called antibiotic resistance.
Right.
What's the risk with that?
One of the things is making sure that when you have an antibiotic that's been prescribed for you, you take it exactly as it's been prescribed. You need to complete the entire prescription because if an organism is not completely eradicated and it's been exposed to that antibiotic, maybe in the future if you get that same type of infection again, that same antibiotic will not work against it. So you want to really be careful about, taking the antibiotic as it's been prescribed, completing the entire course. There are people who, it's a very hard economic time. People will think, oh, I feel better now, I can quit taking this and I can save this for the next time. And you may not have actually gotten rid of the entire infection, and that can cause a problem for the next time it comes up. So you need to be careful with that.
Well, great advice, and a lot of people sniffling and sneezing. I've heard a lot of people that have bronchitis, so some timely advice, certainly. Thank you for giving that reminder and information to our viewers.
And one thing I think it's really important, if you're in the hospital, it's also you can really feel comfortable asking the nurses, the physicians, whoever comes into your room, have they washed their hands, and really kind of take some of that matter into your own hands.
Great. Well, thank you so much for
You're
being
welcome.
with us. We'll be right back with a check of your forecast.